There are quite a number of things I'm excited about. The first is the fact that we're leveraging on technology to improve service delivery. And I think that's important, particularly when we consider the way the pandemic has affected service delivery across the world, more particularly even in sub-Saharan Africa, right? The second is the reality around the performance management that we will now be able to institute. And to do that, it means that we have better access to data real time. We're also able to utilize this data and analyze them and make decisions in a way that allows us to even improve access to care and the quality of care that we deliver in the state. The third, of course, is around the digitization, right, of the revenue collection. As a state, we're investing very heavily in our primary care facilities and also our secondary care facilities. This year alone, we're doing over 2.5 billion naira worth of investment in our secondary care facilities. And what more way as a health sector do we need to demonstrate that we can also be a significant net contributor to the state's revenue than showing that we have the ability to collect these revenues in a electronical manner, but also showcase, what we collect. And the value of digitization of revenue collection really is in ensuring that we minimize wastages and leakages. So we see this as a partnership that also allows us to, leverage on private sector capacities and capabilities to improve public sector expertise, and we're looking very much forward to it. Finally, on your point on quality of care, absolutely, the timeliness to be able to attend to patients, the safety measures in place, the different, what you consider APIs that will be put into place to ensure that, patients can receive good quality care, helps us as a state as well to improve what we're working on.
So this is roughly about a 6 to 8 months journey that we're seeing here today, and this is consistent engagement with government. The state government has actually prioritized healthcare as a service as a critical intervention area. So there was some, alignment in focus as regarding this. So it was easier for us to actually get through to them. So it was a robust engagement to ensure that all parties within the healthcare space, all stakeholders that were concerned as a primary part of this process was engaged and ensured that they were happy to allow for the success of this project.
For me today, I'm very, very excited because history is being made that we're in partnership with Helium to digitize Ekiti State. What I see is that at least revenues will be increased, health outcomes will be improved, medical records will no more go missing. We've been working with Helium since last year, and we are already in 5 countries, and they've done several hospitals. And we've seen the improvement this has done. This is not the first project we're doing with them. We've done other projects on the private side, but this is the first government hospital we're working with Helium. So we're looking forward to this. I know a lot of people have this feeling that they don't want to go to government hospitals. Because of the wait time. Well, I know with this digitization, in fact, people will leave the private hospitals and go to the general hospital. For this is exciting for me. And we're starting with 4 major hospitals where I know going to hospitals is a Herculean task. I know with this, things will definitely improve. So for me, this is very, very exciting. So I'm saying kudos to the Helium team and well done.
So this is really exciting because data-driven healthcare is the only logical future, right? You want to know who you're seeing, what you're treating, how many of such. In the wake of COVID and other pandemics that Nigeria has historically had, there is Lassa fever, it's monkeypox. Being able to localize symptoms will always help you to identify who patient 0 is. And it's not too much of a stretch to say that the only way you can do that is if you're not relying on paper. Paper is the enemy. Okay,
the purpose of coming together to sign this MOU is for us to be able to have a formidable data that will be of assistance for planning and implementations of the healthcare delivery in Ekiti State. Particularly the budding disease, we should be able to know what type of disease do we have, and again, how do we, make provision for it. You are welcome.
So the goal of this partnership is to see 100% digitization of the processes that exist within the different facilities that we're going to deploy our product at. And we've done this over and over repeatedly over the years in different facilities, be able to take both private and public facilities digital. So we are coming with a wealth of experience and with also the technology and the manpower to make this happen. And what we hope to see at the end of the day is to see a quicker response time when it comes to managing patients. What we hope to see is to see informed decisions being made as a result of the data that is being gathered at all of these different facilities, and able to help the state also have like a better oversight in terms of analytics of what is happening within the healthcare sector, so they can also better manage their resources. They can deploy resources from where it is not being used to where it is being even more necessary to be used.
This is a really exciting signing ceremony. Helium Health is a company I like very much. I'm very impressed by the work they've done so far. The work that needs to be done to digitize healthcare records, to improve the quality of care, to finance healthcare institutions is significant in ensuring that citizens across Nigeria have access to quality care. I'm very excited to see Helium Health and Sterling Bank, one of our bankers in the Ekiti State Government, have collaborated to launch this digitization project in Ekiti. I'm really keen to see the outcomes of this project. I'm sure it will not only improve the quality of care, but it will also give us access to much better data that improves our ability to plan for public health outcomes. With the COVID-19 pandemic ravaging the world, it has become incredibly important that we provide decent healthcare outcomes to all our people. And health has to be treated as a social good. So I'm very excited to see this happen. I wish all the parties a successful partnership. This is an amazing opportunity at seeing what public-private partnerships can do to deliver even social services. So once again, congratulations Helium Health, congratulations Sterling Bank, and most importantly for me, congratulations to the people and the government of Ekiti State.
We saw the excitement. There was media from everywhere. And it's just to mark this very significant outcome, the digitization of healthcare within the Ekiti State. And of course, with the hope that this message spreads out and branches out to every other state and even far beyond Nigeria, Africa, and everywhere Helium decides to take their footprints to.